Nagaland thagya manukan karne khushi khobor ekta de tuk manukan bimar hoigina treatment kurobo na parya kan ge poisa komti par treatment dibole paria center Chumoukedima de khulibole ase aji tu center hope healthcare aro diagnostic lab laga aji agriculture laga advisor matang yantan foundation stone de krishe itu health center do finding hope kuigina American organization ekta pra fund kri ase detail report sab
charitable health clinic or diagnostic lab or agade na because of personal reasons in the family health issue thakane idu initiative to hola je you know online thado collaboration with an American organization idu money de set up kuru hola ase aro idu it'll be a normal setup clinic holi bi ekta keba lagta do will be offering significant discounts koma de ekdom 500 be afford kuru na pare. So depending on the situation, that patient can have. So depending on the situation, doctors will say na kiman discount dibo, or if napare gulo dini freebie guru dibo na in operate guru la asa. So doctors so yeti do prominent doctors Nagaland bra hai ide bisari na employee guru. Holibi aro bahar bra down the line ide medical team can have from maybe from Brazil, from America, tan haigina. Ede free service kana higina tang dental doctors kana or specialist kana higina future down the line tan higina ede serve kuru olive ede local doctors kan rakhibo local doctors and nurse kan so that's why ede oye ede ane mon ede that American organization no the mon type puri na tahan dade funding pattern higina so that the funding can support the overheads of the clinic to ede hanuman discuss kurna kuri na higina okay fine India gana ekta team form group in America. So the team form they will be responsible in our funding han kipa group. So funding area maybe from Australia we future prospect job so even from Australia, from European countries and from American countries they will help us to find support, financial support to operate this the clinic here in Naga.
Apart from the clinic lab testing
yes, initially the one in the basic shuru guru because one market test guru so it might take 6-7 months time to lower. That's why one khali foundation do lay guru na say the groundwork guru so initially the pathology lab and a blood test khan la guru in our naste as we progress upgrade guru in a minor OT or maybe full-fledged operation theater or maybe it might even become a hospital one didn't na jane
is it going to be a 6 days in a week clinic?
Yes, Sunday, normal working hours.
So I also pay 60%
depends. I do doctor management can take you. So situations I so we do the we still have to work those things out. Only up to 60% with medicines, consultancy or lab or maybe free of cost na idhan. So those details we still need to work out. Base foundation already set up kurigina. So there's a lot of processes out there. It'll be challenging. Locally we have to raise support. So it's challenging. That's why we're taking up this challenge. One of the most significant projects we were working on was the creation of children's home here in Dimapur, Nagaland, Nagaland. But just as things were moving forward, life threw another curveball at us. My wife was recently diagnosed with sickness we never expected. The news was a huge blow. As I sat beside her in the hospital with fear, uncertainty, and emotions as well, I couldn't help but think about the future of the children's home. How could we possibly continue this project if we are facing such a heavy burden? After much prayer and heaven reflection, we made a grateful decision to put the children's home on hold. The health and well-being of my wife had to come first. So we focused on the treatment for healing and recovery. Even if she overcame her sickness, I knew that the pressure and the challenges of overseeing a children's home would be too much for her to handle in their condition. Well, while my wife was undergoing her treatment in Guwahati, I was so grateful that, despite the burden, we had somehow gathered the resources to keep her care going. But in that moment, my heart also broke because there are so many people who are not getting the basic medical attention they need because of lack of finances and resources. That evening in the month of October 2024, as we talked quietly about a journey, something powerful clicked between us. We both knew that if we had the means and the resources, we could make a difference. Together we came to a shared vision, a charitable health clinic, a place where people could receive care no matter how challenging their financial situation may be. So this dream was born out of a personal journey that changed our lives forever. Out of pain, something beautiful emerged. This healthcare center is my way of honoring my wife's courage and resilience. It is my way of standing up to those who feel forgotten and deprived. This mission may be big, but it is possible. And together we can make it happen. With Finding Hope Global, we will bring change, inspire hope, and transform lives.
We work in Romania, that's in Eastern Europe. We have children's homes for children, orphan children that have been abandoned. Then we have about around 40 children total within 3 homes. That's how we started. We started with these children's homes. My wife was an orphan. She grew up in children's homes and she wanted to give back. So I had been doing business in Romania, and when I was doing business ventures, traveling, we did a lot of import-export business. She brings kids in the home, and before long we had more kids, and then we had 40 kids in our home. And so I had to make a nonprofit. So we made this nonprofit in Romania with helping orphans. I never really intended to make the nonprofit, but it just sort of grew organically from my wife's heart and eventually into my heart. I had as you mentioned, I'm a doctor. I studied medicine. My intention was to go into medicine and become a doctor. I worked a little bit in the United States as that, but eventually I found myself in Romania because of the business, and my wife got us involved with orphans and started children's homes. And it just grew. You know, it wasn't a planned thing, and I think that's how life happens a lot of times. Opportunities come, and events, life pulls us in directions. And I just knew this is where I needed to go. I needed to give up my work as a medical doctor. And eventually I even gave up, this last year, I gave up my work as doing business. So now we operate full-time as a nonprofit. We have our children's homes in Romania, but not only in Romania, and me as an American, United States citizen, we're as our nonprofit group, we're based out of the United States, so we're incorporated there. Their funding is a little easier because it's a prosperous country. So in addition, we also have work in the United States. We have children's homes. We're starting children's homes in the United States, camp facilities. In addition to the United States, we have launched last year our work in Brazil. We're starting we have a community center there currently with an after-school program. We work in the slums. We get the kids from the slum areas, what they call them favelas. We bring them in and get them educated in our after-school program. We also have a piece of land. We're developing a private school for these kids from the slum areas that don't have access to education. This is in Sao Paulo, Brazil. And lastly, we're here.
We are really grateful to Finding Hope organization for the service that you are rendering and for bringing an island and for your decision to establish this Finding Hope India and Foundation for Healthcare and Diagnostic Lab established here in Timor. This shows that your commitment is really extending the healthcare where it is needed most. I I would also like to thank the organizer of this program for remembering me and giving me the privilege to inaugurate this noble initiative this morning. Thank you, Apollo, for the accolade that you had showered on me, which I don't deserve, really. But it is indeed truly an honor to be in your presence this morning, to stand before you as we mark the beginning of an institution that embodies service, healing, and transformation. This institution is more than just opening of a facility. It's not just opening of a facility. It's launching of a mission that promises hope, health, and healing to the homeless individuals around the world. It is also noteworthy to mention that this institution, this Fighting Hope, and this very diagnostic lab is brought by a family, an individual who has received hope, health, and healing. It's really wonderful, and it's really befitting that somebody who has received healing has brought this, and she's doing the running, the family, that the husband and the wife is doing the running. So it's really, really great, and I wish all of them a very successful venture in the future. As we all know, in a world where quality medical care remains out of reach for many, initiatives like this brings light, a beacon of light, proving that compassion and commitment can truly make a difference. For those of you who are coming from outside, Dimapur is a city of diversity and growth. This is the only city in Nagaland which provides medical care to the rest of the districts in Nagaland. And in spite of the medical care facilities that are provided here, we also face a lot of challenges. One of the pressing challenges is the accessible and affordable health care that is lacking in Nagaland. So establishing this foundation for healthcare and diagnostic laboratory is a significant step towards reaching that care. I would appreciate and also thank the founder of Foundation Finding Hope, Dr. Netan, for this visionary leadership that you are providing, and for coming up with this beautiful and very noble venture. As I see, you have the organization has spread to 5-6 countries, and India being one, and also reaching Nagaland, which is a wonderful job that you are doing. You are not only providing healthcare services, but you are also taking up a lot of other philanthropic works, like orphanage, random orphanage, and things like that. So this is a really wonderful job. I must thank you and also appreciate your initiation. It only proves your hard work, dedication, and belief in a better future, which have led us to this moment today. This laboratory is going to be run now by the doctors, the nurses, technicians, and staff who will serve here. You are both professionals. You are lifelines to those in need. Your dedication will not only heal bodies, but also ignite hope in the hearts of many.